You're listening to Lasting Recovery. Once again, here's your host, Dr. Judy Saalinger.
Welcome back to Lasting Recovery. I'm Dr. Judy Saalinger, licensed marriage family therapist and certified addiction specialist and clinical director of Lasting Recovery, San Diego's premier holistic outpatient alcohol and drug treatment program for individuals and their families. We're nationally accredited, and we offer you hope, and we believe that you too will begin to learn that there is help for you and your family. You do not have to sit there with this disease. What we're going to talk about are some secrets of a successful rehab. And the secrets of a successful treatment have to do, first of all, with the fact that the family's there. When we have a family that is wanting to come in and get some help, the mother, the father, the kids, the husband, the wife, that's when we see success. And today I have with me Ed Lacey, who is an international addictions consultant. And Ed, welcome again.
Thank you. Thanks, Judy.
I'm really glad that you're here. And talking about the families, you've worked with families over the years, for the last 25, 30, 35 years. I won't go any longer, maybe a few more.
No.
But Ed has been doing this kind of work as well. And Ed, when we talk about the secrets of successful treatment, we have to first look at we have to have an intervention with families. And could you talk a little bit about that?
Sure. And I think that part is difficult, not so much for the person doing the intervention. I think it's from the family system. Remember years ago they talked about the 3 rules in the unhealthy and I use the word unhealthy instead of dysfunctional. That word just sort of like turns my insides. But the fact of the matter is it's functioning, but in a very unhealthy manner. And it talks about that we don't trust, we don't talk,
and we don't feel.
And we don't feel.
Yes.
And so in a healthy system is in doing the intervention is getting families to see that. And that's not easy.
Yes.
We become so fixated in our unhealthiness that we think it's healthy.
Exactly. Well, it's the only way we know how to function.
Exactly. That's right.
Yes.
And so you're telling me after, let's say, 10 years, 20 years, 15 years of marriage, whatever it may be, or in relationship with he or she or with my children, that what I'm doing is unhealthy, and that's threatening. That scares the heck out of me.
Sure it does.
And you know what? I don't know what else to do.
Right.
And I can't tell you that because, see, I don't, as I mentioned earlier, I didn't know that I didn't know.
Exactly.
And I couldn't see that I couldn't see.
Yes, that is so powerful.
And that little spark of willingness to be able to open that door a bit to say, maybe there is something to what this guy is saying.
Yes.
And to begin to talk to them about, you talked about what happens in lasting recovery. And, the first thing I know that Irving Yalom talked about is that installation of hope.
Yes.
That they'd be surrounded by a group of people who can aid them in those new discoveries and this is so important, and give them tools to help them make that change.
Yes.
It's a complete paradigm shift within the entire family system.
Exactly. That concept of a paradigm shift, I use that a lot with people because they do have to learn all new ways. And they think that, a family member can come in and say, well, he ought to stop drinking, and I don't have a problem because I don't drink. I drink socially, perhaps, maybe what they'll tell me, but they say, I don't have a problem, everything's fine with me. When we really begin looking at the hurts and the sadness that they've experienced, then we can begin seeing that the family system does indeed need to change, and they can see it when people start telling the truth. And so when we look at interventions that do work, one of the things that I want to tell you sitting in the car, or you that's sitting in your kitchen there, is that you can quit the power struggle. You are not going to win this.
Right.
And this is a part of surrendering and letting go of that which doesn't work, and being open and willing to renew your life, to restore it.
And I think what you said is real important. It's a power struggle. It's not going to work. However, some people, because of that denial and the fear and the shame associated with that, are willing to stay in the pain because that's all they know.
Exactly.
And that's a tough barrier to help break. And that's where, again, that intervention, that being able to intervene, put something between two thought processes and give them a little bit of hope with a phone number that says, at Lasting Recovery, we can introduce you, guarantee you, that we can give you 100% of the tools you need to make the change.
Exactly. Whether or not somebody uses those tools, that's up to them.
Exactly.
However, I like to try to show you how they're going to help you. And they're going to help your family, and they're going to help your children and your grandchildren and your children's children, because this is a new way of shifting your family into a recovery process.
Right. And I think the other thing I was just thinking about, too, is the fact that when one person's been trying to excessively control a situation for so long, for them to move out of that controller seat is scary.
It's very scary. But the truth of it is that the reason why they're controlling is because they're afraid.
And it's also my sense of identity, right?
Yes.
I mean, it's who I am deep down inside. If I let go of that, what have I got left?
What have I got left? Yes, and it's a scary place to be. I know. I've been there. I've been there. I've struggled with this disease and intergenerationally, and what we have to do is to recognize that it feels like jumping off a cliff. And I know for myself that's what it felt like. It felt like I was jumping off. Now, what am I going to do? Now, I remember reading something about change one time, and it said, that you can sort of develop this trust if you can, as you jump off the cliff, that you can begin trusting that you're going to have something solid to land on, or you're going to be taught how to fly. And what happens at Lasting Recovery is that we teach you both. We give you something solid to stand on. You can come in and talk about it. We're going to give you books. We're going to give you all sorts of things and tools and all sorts of experiences that will help you. And out of that, we're going to teach you how to fly.
There was a treatment center years ago, and their motto was something to the effect, it's not your fault, you're not alone. And I think that Lasting Recovery, you guys are evidence of that. When families as a whole begin to make that change, that there's a safe environment, that there's a place where where there's trust.
Right.
There's separate groups for the moms, separate groups for dads or males, separate groups for where the adolescents can get some help. And then bringing them together in the family program where they can all begin to experience a new way of talking, experience some trust that may have never, ever been in that relationship at a real cognitive level.
Yes, that part is so important. And again, in the safety of a group process where people can talk about it. And when you have family groups, you have other people talking about it for you, which again gives you permission. And so when we move into a treatment mode, and people are given permission to talk about their feelings and given skills and tools to, again, reduce the stress that's been so paramount in these family systems, then we have healing. And people will talk about, now I can feel. Now I've been given permission to feel. You can reach us at Lasting Recovery at 858-453-4315 or at www.lastingrecovery.com. And
now, what happens when I make that call? Let's say I pick up that, as you mentioned earlier, that 1,000-pound telephone. Well, what happens? Okay, I'm ready to make the call. Sort of tell me a little bit about that.
What happens? Okay, first of all, the phone will probably be answered by Tamara or Susie up front, and we'll get you to Tamara. Tamara's our admissions director, and Tamara will help you to understand it. Like all of our staff, they've been there. Everybody understands this disease.
That seems a little scary. I'm making that call.
Oh. Well, you know what? You don't even have to give your real name if you don't want to. Okay? You don't have to give your name. You can just say, I just want to talk to somebody. I heard Judy Saalinger and Ed Lacey talking on Lasting Recovery on KCEO, and I just want to find out, what can I do for my family? I mean, what can you do that I haven't been able to do? Because you see, this is a real step for you listeners to make. When you recognize that your control is not working and that you need outside help. I recognize it. This is the toughest thing.
What will she invite me to do, do you think?
She would invite you probably to come in and talk.
Okay.
She might invite you to visit our website. She might invite you to attend an Al-Anon meeting for families and friends of people who have substance abuse problems. Now,
is there some sort of commitment on my part if I'm willing to come in and talk?
No, not really. The idea is for you to be able to come in and say, well, what can I do about it? You need to have somebody to talk to, and that's really what we do. We try to help families. We try to, and I think we do help families. I have had so many testimonials of family members who said, "Thank you, Lasting Recovery. Due to your teamwork, my family is healed." I had one woman just, a couple of weeks ago. She and her husband he had been in treatment for his alcoholism, and she came every week to family group. And I knew they were going to make it because she came every week. She didn't just blow this off. She took it serious. And she said, "You not only saved my marriage," she said, "you saved my family."
Try and save my life.
Save my life, yes.
So who would I see if I were coming in? I mean, who would I be sitting? Would I be able to sit and talk with you?
Yes, you can.
Or what kind of people are there that I may talk with?
You could talk with me. You can talk with Diane. Diane's a counselor. Diane works with a lot of adolescent families, and I do like to meet everybody that comes through our center if they come in.
Is this like an educational experience, you think, or what would happen? I mean, like, sort of educate me here a little bit.
Well, it would be an educational experience because I would help you to understand a little bit more about the addiction. I would help you to see the addiction for what it is. That's a hijacking of the brain by chemicals. I would help you to, in the family system, to see how progressed it is and where it started off and how far down it's gone. And the fact that it's the only way you can turn this around is to jump ship by coming in to change the paradigm that you're on. Help you to identify some relapse triggers, help you to understand that the brain's craving response, the brain's triggering response of the thoughts and behaviors involved in this will be activated. Offer you to be able to learn how to detach. I'll give you, I'm a former teacher and I love to give handouts to people, so I'll give you handouts on letting go, handouts on how you've been caught in responsibility trap. Lots of different things.
Sounds like an incredible experience.
Well, I think it's helpful. I haven't had anybody say this was not worth my time and money. That this experience here helped me to understand it. Now I'm going to do something. So
today's program might be about hope also.
It's about hope. Yeah. It's about hope. It's about being willing to change your paradigm, being sick and tired of being sick and tired. You do not have to suffer with this disease any longer. And so for those of you that are family members, if you're sitting there in that car, do something today. Give us a call at 858-453-4315 and tell us that you want to do something different. You are sick and tired of being sick and tired, and you want to do that thing, which it takes.
Most times when I hear about codependency, you generally hear there's a generalization. It's about women, and women who are codependent, and women who are controlling, and women who are trying to, where'd you go, what'd you do, who'd you see, but what do you see in your practice? Do you also see men with this?
Oh, yes, I do. I see lots of men who are people pleasers. They they learn to survive by saying yes, yes, okay, whatever you want. That's how they avoided conflict when someone had a substance abuse problem. So they get into relationships by trying to please everybody and trying to rescue, trying to control things. Men are not as likely to go to support groups, but believe me, we see lots and lots of men who have codependency issues. Anytime somebody that has been raised in an alcoholic family system, they have codependency issues. And when we talk about that, I just want to say that basically it's about you're overextending yourself. You get into a place of denying your needs, feeling that you're suffering, and you are suffering.
Right.
Only the thing is you're the only one that knows that.
Right.
And so you get resentful.
Let me ask you, I'm going to just interrupt if I can. You see,
Sure.
You're the only one that knows that. You know, a lot of them are out there trying to function thinking that's life, that's normal. What would you say about that?
I don't think it's normal. Again, we go back to the statistics, and we're saying half the American population has been affected by substance use. And so those people that are suffering, they're actually putting yourself physically at risk for other diseases because the stress level that you have to live under in order to feel to sacrifice yourself can put you at very high risk for a heart attack, stroke, cancer, all of the resentments that people have around this disease. And so
there's a big word too, a resentment, that deep-seated anger that's
Yes.
in there. But what I was getting is that I think that a lot of people don't even realize the depth of where the codependency can take them.
Yes, that's very true.
And they believe that that's like their destiny in life is to live this kind of life, going out trying to rescue people and controlling people, and,
Yes.
and they don't know that their own internal pain, what's going on within each one of them.
Right. And so, Ed, as we talk about this today, I'm really glad that you brought that up because it's the level of pain that people are experiencing because, number one, they're running in fear, and number two, they've been denying their needs for a very, very long time. And they may have been brought up with a sense of it's selfish for us to take care of ourselves. I know I grew up with that, and I couldn't take care of myself and do the things that I needed to do because I felt that it was selfish and self-centered. And I want to tell you out there, it is not selfish and self-centered to take care of your needs. It becomes your responsibility to your spiritual self.
And I think it's rather exciting. I'm working with a woman right now, a 65-year-old woman who's been in a marriage for 30 years, 30 plus years, and doing those same dynamics we've talked about today. And all of a sudden, the gentleman is out of the picture. He's not there anymore. And it's almost like the lights are on and nobody's home inside this woman. She's lost, and trying to give her some hope that the woman who may come through this entire process is going to be this wonderful, vibrant lady. And that's very fearful.
Very fearful for her because she feels empty. Again,
and her identity was through the gentleman.
Exactly, and this is what happened. So, when we talk about treatment and what it is that that treatment can do for you, we want to let you know that you can begin to think clearly, keep your commitments to yourself, and that you can begin feeling good and feeling energized because you're running your own little body system. They talk about the mind, body, spirit. You've got to focus on your own. You'll have less anxiety. You'll be able to be honest with yourself and identify what you can control in your body and what you can't, and lots of new communication skills. So today we've been talking about substance abuse in families and how we can heal it, how lasting recovery at www.lastingrecovery.com if you want to go there, how we can help you and your family system, whether it's your child, your husband, your mother, your brother, your sister. We want to be able to let you know that substance abuse in families causes more problems than any other issue, and we want to help you get beyond that. So we also talked about today about substance abuse is increasing, potency and severity of drugs is increasing, and parents and wives need to break this no-talk rule, because we talked about how people get around this don't talk, don't trust, and don't feel. And I know in the family group when I mention that, people say, oh my goodness, she's talking about our family. How did she know? So if your problems aren't resolved, you can contact Lasting Recovery. You've been listening to Lasting Recovery. I'm Dr. Judy Saalinger, licensed marriage family therapist and addiction specialist, clinical director of Lasting Recovery. Thanks to you, Ed, for being here, and thank you, Rick, for being our engineer today. Thank you. Have a great week, folks.